If you look at some of the first publications of the disease, characteristics of it, they have very good documentation of the clinical manifestations, how these patients present, the swelling, the belly pain, but they really didn't know what caused it. They did note that patients, when they were under severe mental stress, this would precipitate some of their swellings and some of their symptoms, and so they thought that the nervous system played a role behind the disease and behind acute attacks of the disease. It was called hereditary angioneurotic edema. They did know that it was hereditary and it was passed on through families. Nathaniel Hawthorne, in his book, The House of Seven Gables, described this family that had hereditary angioedema. And he said that they would choke on their own blood, that they would gurgle in their throat and gurgle in their chest, and that a curse was placed on the family. And it's thought that this family had HAE, but again, it was a curse, and they didn't really know a lot of the biochemical stuff, pathways behind the disease. Once we were able to classify families of patients, we were able to take their blood and study it. And then in the early 1960s, Dr. Donaldson discovered that C1 inhibitor was deficient in these patients. And then we were able to see the role that C1 inhibitor plays in the body. It has an important regulatory function in the complement cascade, in the kinin pathway, and then the coagulation pathway. And studying these pathways, they were able to narrow down C2 kinin and bradykinin as potential mediators of the disease. And then in the late 1900s, we found out that bradykinin was ultimately responsible for the swelling in this disease. Bradykinin is produced in the kinin pathway. In the vascular endothelial cells, prekallikrein is turned into kallikrein, and then kallikrein helps convert high molecular weight kininogen to bradykinin. When you don't have C1 inhibitor, you can't inhibit kallikrein, so you have increased production of bradykinin. Bradykinin binds on the bradykinin 2 receptor found on the vascular endothelial cells. And then through intracellular signaling, bradykinin then increases the space between the cells of the endothelium. It downregulates VE cadherin, so you kind of lose the glue in between the cells, and then that allows fluid to leave from the blood vessels into the body, and that manifests as swelling and angioedema.